Welcome friends to my YouTube channel Pharma Solution. Today I will discuss about most important MCQ on anti-cancer drugs. Please like the video and subscribe the channel and press the bell icon for notifications. So let's start. Question 1. Which anti-cancer drug comes under the cell cycle specific? Option A, Vinblastine. Option B, Daunorubicin. Option C, Paclitaxel. And option D, all of the above. And the right answer is option D, all of the above. Question 2. Tyrosine protein kinase inhibitor is option A, Imatinib. Option B, Irinotecan B. Option C, Sunitinib. And option D, Bortezomib. And the right answer is option A, Imatinib. Question 3. Anti-cancer drug act as topoisomerase 1 inhibitor is option A, Irinotecan. Option B, Etoposide. Option C, Estramustine. And option D, bleomycin. And the right answer is option A, Irinotecan. Question 4. Sarcomas means option A, malignant growths arising from epithelial cell. Option B, malignant growths of muscle or connective tissue. Option C, malignant tumor arising from glandular tissue. And option D, none of the above. And the right answer is option B, malignant growths of muscle or connective tissue. Question 5. Anti-cancer drug act as a aromatase inhibitor is option A, Dutasteride. Option B, anastrozole. Option C, Letrozole. And option D, both B and C. And the right answer is option D, both B and C. Question 6. Anti-cancer drug act as 5-alpha reductase inhibitor is option A, Rituximab. Option B, Bortezomib. Option C, Sunitinib. And option D, Finasteride. And the right answer is option D, Finasteride. So 5-alpha reductase inhibitor is Finasteride. Question 7. Which anti-cancer drug is mainly used in the treatment of chronic myeloid leukemia? Option A, Methotrexate. Option B, Cisplatin. Option C, busulfan. And option D, Doxorubicin. And the right answer is option C, busulfan. Question 8. Nitrosourea are highly lipid soluble drug mainly used in the treatment of option A, brain tumors. Option B, lung cancer. Option C, breast cancer. Option D, all of the above. And the right answer is option A, brain tumor. Question 9. Which anti-cancer drug is most emetogenic? Option A, Cisplatin. Option B, Doxorubicin. Option C, Sunitinib. And option D, Imatinib. And the right answer is option A, Cisplatin. Question 10. In which phase methotrexate act of the cell cycle? Option A, S phase. Option B, M phase. Option C, G2 phase. And option D, G1 phase. And the right answer is option A, S phase. Question 11. Methotrexate in low dose 7.5 to 30 mg used for treatment of option A rheumatoid arthritis, option B brain cancer, option C prevent joint erosion, and option D both A and C. And the right answer is option D both A and C. Question 12. The toxic effect of methotrexate on normal cell can be minimized by giving option A Mesna, option B folinic acid, option C vitamin B12, and option D both A and C. And the right answer is option B folinic acid. Question 13. Cytotoxic drug induced vomiting can controlled by option A Ondansetron, option B Omeprazole, option C Granisetron, and option D both A and C. And the right answer is option D both A and C. Question 14. Following drugs are cell cycle non-specific except option A Vinblastine, option B Chlorambucil, option C Cyclophosphamide, and option D Cisplatin. And the right answer is option A Vinblastine. Question 15. Mechanism of action of vinca alkaloid is option A bind to beta tubulin and inhibit its polymerization into microtubules, option B inhibit DHF reductase, option C interact with topoisomerase 2, and option D activates HGPR transferase. And the right answer is option A bind to beta tubulin and inhibit its polymerization into microtubules. Question 16. Which anti-cancer antibiotic shows cardiotoxic adverse effect? Option A Doxorubicin, option B Actinomycin D, option C Mitomycin C, and option D both B and C. And the right answer is option A Doxorubicin. Question 17. Which anti-cancer drug contain pteridine ring in the structure? Option A Doxorubicin, option B Methotrexate, option C bleomycin, and option D lomustine. And the right answer is option B Methotrexate. Question 18. Which anti-cancer drug is M phase specific? Option A Paclitaxel, option B Etoposide, option C Methotrexate, and option D Topotecan. And the right answer is option A Paclitaxel. Question 19. Which anti-cancer drug is used to treat prostate carcinoma? Option A Flutamide, option B Methotrexate, option C Finasteride, and option D both A and C. And the right answer is option D both A and C. Question 20. Chemical name of Mesna is option A 2-mercaptoethane sulfonate, option B Mesnex, option C Mercaptopurine, and option D mercaptoethanol. And the right answer is option A 2-mercaptoethane sulfonate. Thank you for watching the video. If you like the video, please like, share and subscribe the channel. Thank you.